Good morning, everybody. I'm Rachel. I'm the Chief Executive of the Patient Association, and I'm delighted to be here today. Today is the end of our Patient Partnership Week, and I want to just firstly thank quite a lot of people who I see have been at a number of our webinars this week. It's been a fabulous week, and I know I personally have learned loads from listening to the Q&A and listening to our brilliant speakers. So like I said, my name is Rachel, and I'm the Chief Executive of the Patient Association. And before I hand over to our speakers, I want to set the stage by highlighting some of the crucial points about the use of patient data and why understanding patient experience is so important. Sandra and Amin, thank you so much for joining us to take that part on. And Rebecca, obviously from the NHS, thank you for joining us. So we know that the use of patient data has already transformed the NHS, and its potential to improve patient care is immense. And through our work at the Patient Association, through surveys, through focus group, through our national free phone helpline, we've identified areas that patients consistently tell us about their NHS care experiences. And what they tell us is they want their healthcare teams to have readily available access to the information needed for treatment. They want to be fully involved in decisions about their care. And as those of you who know the Patient Association, we are our purpose is as patient partnership in the design and delivery of services, and in individual consultations around that role of shared decision making. And the other thing that patients tell us regularly is they don't want to repeat their story every time they use the NHS. So these points all speak to a desire for more joined up care, where information flows seamlessly between different parts of the health service, ensuring a smoother, more effective experience for patients. And what we believe that role of data and digital and well-connected systems means that patients don't have to repeatedly share their medical information at each new appointment. Healthcare professionals have access to the patient's full medical record. And the other bit that we hear all the time through our helpline is that want and wish to be able to access their medical records and how to do that. So today we'll be hearing directly from Amin and Sandra about their experiences around data and care coordination in the NHS. And their stories and insights are crucial in understanding both the challenges and the potential benefits of improved data sharing. So, and it's great to have you here, Rebecca, too, because you're going to be able to listen firsthand to Amin and Sandra, and I know that you've been doing that in other ways as well. But we know that research that we've done, and I see that the University of Manchester are on the call as well, and they did a piece of work around kind of data sharing and data, and we what we hear from patients is that they're genuinely positive about their data being shared to support their direct care. But we need to understand the concerns and communication away with patients in the way that they understand, because the relationship between patients and their data is intensely personal. And I think you're going to address a little bit of that, Sandra. And so we must, as a patient association and the healthcare system, we really need to respect that importance and that personal about our personal healthcare data and the importance that has with us. So I'm not going to talk for much longer because you're not here to hear from me. We have a set of patient partnership principles, and which we believe that if they're implemented, will allow for an NHS for the future that works for all, both patients and healthcare staff. And one of them is around joining up services, which is where we're going to talk about data today. So I'm going to stop and I'm going to hand over to Sandra. And Sandra, thank you so much for joining us.
Good morning, everybody. I'm really happy to be here. So I'm all for data being, data is crucial. The role data has in making sense of the big picture. Yeah, that there's no dispute about that. That absolutely is essential for making sense, making use, planning services, seeing the trends. All of that's good stuff. Not an issue at all. I think an area of concern for me is really about the individual. So data is about the big picture. And obviously data can be about the individual as well. But I'm really concerned about, as a patient, getting lost in the system. And so both my son and I have recently been in hospital. I was in hospital a month ago. It was a planned admission, fabulous. In fact, it was private care under the NHS. And it was really good. Okay. My son, we had an emergency situation, unexpected. That also worked well. But we've been in the system a very long time. He's been an asthmatic since he was 3 years old. We are well known. All of that ran really well. No complaints whatsoever. On the other hand, I've been advocating with a lady who's in a local hospital, and she was admitted in January. She was admitted from a care home. She's actually a young woman in her 40s, but she has complex needs. She was put in a care home from a previous hospital discharge temporarily, ended up being there over 6 months. She was actually admitted to the hospital because the home ran out of insulin and they called an ambulance. She was admitted because there was actually a concern for her level of care, and a safeguarding concern was raised. So she couldn't be discharged there. And she really only needed to be in hospital overnight if she needed to be there at all. She was there for 7 months. She had social work in the local community. She had health budget that was being managed. She had complex needs. There was loads of people involved, and yet somehow nobody managed to speak to anybody in the whole of 7 months to plan a discharge and get her off hospital. And even worse was her concerns were not being addressed. I actually got involved and got pals involved, and they tried. And it was ridiculous how round and round and round this thing was going. The social work team wouldn't see her. The social work team in the hospital, the social work team in the community didn't get in touch, and it just got ridiculous. And so my concern would be, where is the role of data in a situation like this? That's one of my concerns. Okay, I'm going to stop there for a second. At me, Rachel, have you got anything?
I just realised I'd muted myself so that we could definitely hear you. That's really helpful, Sandra. Thank you so much. I think you've a lot more to say.
I'm trying to stop myself.
You don't need to stop yourself. Is there anything else you want to say before I hand over to Amin?
I think I'm okay for now. I'm happy to come back later. Yeah. I think
okay, brilliant. Thank you. Okay. We're here to listen to you and Amin, so you don't need to hold back by any means. Amin, can I hand over to you?
Sure. Thank you very much, Rachel. Good morning, everyone. My name is Amin. I'm a patient and public representative, and I'm a service user. I'm also a carer for my elderly parents. I'm also someone who is working with very vulnerable cohort of patients, homeless, asylum seekers, refugees, etc. So I have very close connection with the patient as well as my caring responsibility. And I've been involved with Patient Association for several years. Through them, I had many opportunities to contribute in various platforms, such as today's one. So in terms of my connection, my experience with data, I would say a massive thanks to NHS for making us enable and giving us that autonomy, power to view our data and through us various platforms. And I could say NHS app is a great example for that. And having access to our healthcare data has helped us immensely. Whereas in the past we had to wait, several hours on the phone call to go to speak to someone at the GP surgery just to book an appointment or request any medical information. Whereas having the opportunity to deal with through the app has given us a great deal of flexibility, so we could do that, within a matter of few, taps on the app. And in terms of managing the long-term health issues and the disability for my parents, my mum regularly visit secondary care, hospital appointment. So one example I can share with you, which was very very helpful. So my mom had to go through a pre-operation before she was having a surgery. So unfortunately, during that appointment, we failed to take some of the necessary medical information. And when we got there, we are about to be told off that because we don't have the sufficient information, you may have to reschedule this appointment. And I did not want my mom to wait another couple of months for her to come back and have the procedure done. All of a sudden springs to mind that I have access to their healthcare data. Why not just quickly log in and quickly view what information I can access? So maybe that might be helpful. So I offered that support to the healthcare professional that we are discussing. And she said, yes, let's look into it. So she could pretty much see all the diagnoses my mom had. She could see all the medication she was on. Also, she could review all the tests, recent test result report she had on her record. She said that is sufficient, so we don't need to go back and forth. So your mom's operation is still going ahead, so we'll give you the letter. So reason why I'm mentioning this incident is because of our accessibility to the data has saved potentially our time, also my mom's time, for unnecessary delay in her receiving the care. And the data is very powerful, I have to say. In the past, I work full time as well as I have caring responsibility. I used to take a lot of time off from my work in order to manage my, fulfill my caring responsibility. And if I remember in the past, I used to have really anxiety early morning. Oh, I got to deal with this for my mom. Tomorrow, I have to do this for my dad. Now having, there is the streamlined process or the platform, I can simply just log in and do necessary things. One thing I personally like from my point of view as a patient, that having access to data, I can see my test results, the volumes. For example, I no longer worry about what LDL means, what high cholesterol, good cholesterol, bad cholesterol. I can see the numbers. I can go on Google and search and educate myself. This is something I really enjoy. But again, the NHS app or the facility that we're enjoying with the accessing our healthcare record, I think the ideas are evolving and changing. It is not perfect. And there are a couple of areas maybe NHS can think of, for example, synchronizing or integrating the data between primary care and secondary care. I'll also give an example of the difficulty we face. Often it is also confusing. Once you get the app, again, app is a really very helpful tool. So often you get a reminder where you got something pending, so you quickly do that. So you click on the app, you log in, then you see there is no action available there. Or app prompts you to book an appointment. When you click on the appointment, there is nothing you can do. So I would say the visibility of secondary care data would be crucial in terms of giving more power. This would not make the patient empowered. It would also save time across both care setting, primary care and secondary care. In terms of the development, I would say, yes, that would be very important for NHS Digital or the people who make this decision to look at how they can more integrate the system across all different settings, all healthcare providers. That would be really, really beneficial. And the struggle we had in the past, that on one occasion I had to take my dad to the hospital, and the consultant did not have the sufficient information provided by the GP surgery. So although my own effort not to delay the procedure, I offered him whether he would accept the online record. He said no, because that's not something he would rely on. I think it also something varies depending on the individual. So maybe having a streamlined process, how we can, give away more power and streamline the process of primary care and secondary care. Overall, I had a great experience having, the accessibility to our data, and also it's been really effective in terms of managing my caring role as well as my full-time employment. So I'm grateful to NHS and all the work has been done so far, and I can't thank them enough. And I think that's for me. Thank you.
Amin, thank you so much. And I know you have some solutions as well that you'll talk about later. Sandra, did you want to come back in before I hand over to Rebecca?
Thank you. Yes. I'd noticed Lee Moon's comment earlier, and I forgot to make a comment about that, because Lee Moon made a comment about patients needing more control over their data. And I'm certainly very wary about people who don't need my information having access to it. And whenever there's an opportunity to say, I object, I object. I don't want it being shared unless it's absolutely needed to be shared. So I do have some concern over that. We know that the private sector has been involved with the NHS for a very long time, and their agenda is their agenda. So I'm not even gonna go there. But I have, and I think it's fair to say within my community there is a degree of suspicion around interacting with agencies of any kind, and so I don't know how fairs can be allied. I mean, it's going to be about evidence. Where is the evidence that our data is not being used? I don't want to say nefariously. Where is the evidence that is actually just about okay? I think that's the basis of the concern. Can I reliably trust that this information that I'm allowing to be used is just about my care and nothing else? And I think the suspicion is no, that's not actually the case. I mean, a for-profit organization is an organization for profit. How do they make profit? So there is definitely concern about data, what's it being used for? And on the flip side of that, I have a nephew who's now 20 who has sickle cell disease and has spent a great deal of his life in Great Ormond Street and other hospitals. And the Black community in the UK, we're pretty small. I think it's somewhere around 3%, don't quote me. And so issues that affect not just us, I know that sickle cell affects people from Mediterranean community as well, but it's a small cohort. And so when I research treatments, for example, I see in the US, they have way different treatments than we have. And so again, we're back to the data. Is that data being collated? Is it being used? Well, where are the decisions about who's worthy? If you're in a small cohort or you have a rare disease, how worthy are you? So some of that, the balance against my personal data is my business and I just want it to be used for my care versus actually my data or my loved one's data could actually be helpful for pushing further treatments for rare diseases.
I think I want to come back to your conversation about rare diseases, but I want to, because I think that's absolutely, and we had John from the Sickle Cell Society on one of our calls the other day, and he brought up exactly the same comment about how we're using it to develop treatments. Rebecca, can I ask you to introduce yourself and give an overview of the role that you're in and some reflections?
Yeah, thank you, Rachel. Good morning, everyone. Lovely to be with you this morning, and thank you for having me. So I'm Rebecca Llewellyn. I work in NHS England within the data services function, and really our responsibility in data services is absolutely to ensure that we are protecting patient data and making sure that we are using patient data to either deliver direct care or improve patient outcomes and improve services that can be delivered by the NHS. So our responsibility, we have a responsibility from an NHS England perspective and a statutory duty responsibility, but we also have a responsibility to make sure that data that is used within the NHS is safe and patients have control how we use that data, and it's only used for direct care at an identifiable level, so where we know who the patient is, and that's around making sure your best service can be delivered. And Amin, you touched on some of those examples of where we can have patients with access to data and you being able to manage your own care is fundamental. And we've had some great experiences, and we hear lots of great experiences. Myself as a patient had a recently really good experience where I was able to book an appointment with my GP through my app. I got my test results through the app. It meant that I could manage that myself. I didn't have to call my GP, which was another demand on the system to ask for test results. It was there, it was ready and available to me. But I also know, and from it's lovely to be here at these panels and hear the insights that Rachel and the team bring to us, and myself and my family that have not so great experiences, and particularly when services are delivered in different settings, and you turn up for a hospital appointment and we have to take our bag of medication because actually our clinicians in the hospital setting haven't got access to the primary care record that actually lists all the medication, and that isn't passed through. And that's part of how the NHS has grown up. We're a over 75-year organisation now, and we are lots of different organisations. We have lots of different underpinning technology, and maybe we want to talk about how we have to sometimes use partners to help us, but that does mean that our data is often in silos. Our clinicians can't access that end-to-end patient journey and understand the true full patient and understand the full information about the patient. So they end up focusing on the information that's presented in front of them that doesn't always give that holistic best care, because actually, as we all know, we're complex human beings, and we have lots of things that need to be known about us to deliver the best care. So some of our ambitions is really to ensure that the NHS can absolutely operate in the most effective way, that our patients can have control of their data, they can understand through integrations into things like the NHS app, and other mechanisms. So I know we all know that the NHS app won't be for everyone, but have the ability to have more control of your data, more joined up data. But that does mean that within the NHS, we do have to do investments in being able to make sure that we can join up that data, to make sure that as a patient, as a citizen, you do have an understanding of what data is stored about you, how that's been used. And as all NHS employees, we all sign up to the Hippocratic Oath. We want to do right by the patient. We want to improve patient care. We want to make sure that that data is only used in the way that helps improve care. And whether, Sandra, you mentioned data about non-individual data, really about planning and demand and making sure that our services are ready for the future. We do have an ageing population, with lots of complex needs, and we do also have a very complex population that we've got to support, and therefore it's important that we do have some of that data that enables us to do some of that planning, but actually at an individual level it's really protected, and it's around clinicians being able to deliver the best care. Our clinicians want to do the best job, but again, Amin, I'm sure they didn't want to send your family home. They want to do the best that they could. Obviously, we don't want to have to rebook appointments. We want to make sure we can deliver care to patients, and our clinicians want to be able to ensure that they understand all the information the patients they're treating, keeping patients safe. Obviously, there's a clinical risk if we don't have all the information we need, and that is best available in secure systems that are protected, that patients understand how that data is used. So that's really what I'm passionate about being able, in the area of responsibility I have, is ensuring that myself, I'm a patient, I'm a citizen, I have family. I want to ensure it's as frictionless as possible for patients to access services, clinicians to be able to provide those services in the most effective way, and ensure that we have the underpinning data that enables us to do that, whether that be at patient level or whether that be at an aggregate level, to understand how we best serve our population needs and local population needs.
Thank you, Rebecca. So what I'm hearing, so data confuses me. So you've got a chair that gets very confused about all of this. Okay, so I may ask some silly questions, but sometimes some silly questions help us get more clarity. So I think data, we're talking about data here, and we're talking about three different levels of data. One is, the system level about, Sandra, your comment about sickle cell, like how are we using data to develop and treatments that allow people with sickle cell and other rare diseases to live their best lives. Now, that's such an important part of data, isn't it? Then you have the planning, Rebecca, of, it was a healthcare professional who told me that, quite often planning around theatre times and who's around and it's an Excel spreadsheet. We have to get past that. It has to be something better than that in such complex. But so I'm going to come in on but the other is the individual level. And I think for me right now, it's focusing on that individual level of the use of data. And I think because you're right, Rebecca, and we are, you know, to have a healthcare system that's fit for the future, we're all going to live longer, hopefully, but we're going to live longer with complex and more multiple conditions. And that's going to, without the use of the really good integration of data, it's not going to make my life great, and neither it's going to make the healthcare system's life great, you know. But I think on the individual level, and it's coming in through the chat and through the Q&A, and it came in through a piece of work that we with the University of Manchester, we did, who've run a big project, and a piece of work that we have done on the data pact. And the first thing is about trust. And I think that's about partnershiping together to make sure that we have that level of trust in place. Now, I know at the moment, Rebecca, there's a big public, I think it got stopped because we went into pre-election period and election period, but there's a public deliberation going on at the moment. Can you tell us a little bit more about that?
Yeah, so you're right. I think things had to be paused, but absolutely across the NHS, and particularly enabling our patients to really understand how we use data, and that data pact of the 5 safes of data, and ensuring that we keep our data safe and secure, and therefore that some of the public deliberation, we're encouraging our patients to come, and citizens to talk to us about how we start to move forward in the use of data. Rachel, I'm not sure if you want me.
Yeah, maybe. I think a little bit more on that if you have it. So I'm trying to get into the chat box. That's into the question. Because Sandra, you took part in that public deliberation. You went to one of the sessions, did you?
Yeah, that was way back in. Yeah, I think it was. Yes. Yeah, we did.
And how did you find it?
The concerns are what's being reflected here. Really, the concern is how can I be? There's an appreciation. There's an appreciation that the data is important for, you know, you mentioned systemic work, you mentioned theatres. I've worked in theatres, oh my God. But as an individual, my data, it's so personal to me. You know, some of our stuff is, we don't want nobody other than the doctor to know about it. We don't want it to be going out there. And so the concerns are just being reflected back here. Is my data safe? Is my data safe? Can it be used to provide better care for me? That's the issue. And this thing about trust is great. Let's have consultations, let's have co-production, let's have, you know, everybody in the room and chatting. What happens 6 months down the line? What happens a year down the line? It would be good to come back. Trust for me isn't about we had a meeting and you told me and I was reassured. I'm not going to be reassured. Can we come back to this 6 months' time? Can we come back to this in a year's time? My interaction with the NHS as a part of the patient public voice is all these big pieces of work come in. I was involved in the 5-year forward view. Then we had the 10-year plan. They come in and then they disappear somewhere. What did that result in? How did that improve or change anything? And so for me, the concern's always going to be, where's the forward planning? How do we down the line decide, actually, that was a really great idea. Let's do more of this. So, wow, hold on. Can we just backpedal a little bit? That for me is something that doesn't seem to get touched on. But yes, the concerns is very much, is this being used to improve my care, as well as other people's? And should I be concerned about what else is being done with my data? Yeah.
Brilliant. Amin, do you want to say anything about trust?
I think I'm a huge fan of data, and as long as the data is shared effectively and safely, I don't see there is any harm. I think only where we can help future healthcare professionals, researcher, by sharing our data. But only thing I would be concerned how this data is shared and who are these people accessing of it. But I have full trust on NHS, whether my data is used at primary care setting or secondary care setting. So I have full faith on healthcare professionals. Therefore, I do understand Sandra's point, but I don't see there is any concern that I have at this moment. So I feel if we don't tick all the boxes for the healthcare professional to access our data, then they might not have access to the data when they desperately need. Therefore, that can result in delaying the care. So I think there are many different data domain, I would say, because we don't use a centralized database. Therefore, how place A can access data, it might not be visible exactly the same way at the place B while they're trying to access this data. Therefore, I think it is very important, and especially if you're dealing with your own health and someone that you care. Of course, at the end of the day, you don't want their life or their care would be affected just because data wasn't there for them to access. So I'm quite optimistic about sharing data and support the future healthcare professionals, researcher. End of the day, I'm sure if they even need to share our data, they wouldn't share our personal details. That will be always kept confidential. So I have no objection. So I'm happy for them to utilize our data search to find the trend of different, the disease, for example, cancer is one of them. I also have done lots of work around data with different healthcare professionals and the researchers. So I'm quite positive about data and how data is shared. One thing I would always question whether it is safe and who else is having this. If he's going outside of the NHS boundary, then I would say no. But if he's still staying with the NHS, I think NHS have the extra layer of the assurance from the governance that they would not just share this to X, Y, Z.
So I'm going to come to Rebecca in 1 second to talk about the trust and building the trust. But Sandra, you've got another point.
Yeah. There was a comment in the chat. Someone's concerned about the level of concern on different webinars about people being concerned about what their data is being used for. And I think the fact that so many people are concerned should raise some flags. And it can't just be, oh, people are concerned about their data and almost as if, that's to be dismissed. People are concerned for a reason. People are concerned based on experience. And so I don't think there's anything wrong with people being concerned. I have a right to be concerned, and I have a right to be reassured, and have a right to seek reassurances and ask questions. I'm not blindly going to follow anything I'm told. My life experiences have told me that hasn't worked very well for me. So I'm going to keep raising the flag and saying, show me the evidence that, this is all great. And it's not being used other than, as Amin said, if it's being kept within the NHS, that for me isn't the concern of it being kept within. It's just I have no issues with that at all. If it's being kept within the NHS, and we know what that's for, we know why we need it. But it's the external influences that's the concern, yeah.
And Sandra, you're completely right. This isn't just, no organisation, including the NHS, should just take a moment in time to go, oh, well, we explained that to you. And that's why we talk about patient partnership in the design and delivery of services, because it needs to be an ongoing piece of work where we're talking, because we're at a point with data right now. It is a point. I am sure that there is more to come as we, when I think back to how we even use these screens now in terms of digital and everything else, look how life's changed now. And, and thinking about how, the things I do on my phone now, in comparison to what, 15 years ago, even 10 years ago. So we have to continually have this public deliberation about how we're using data. And of course, there is real big concerns across using all of our banking apps and our health apps about data breaches. So Rebecca, could you reflect, and I do have more questions for you, and there's questions in there, but there is a big theme coming out here around trust. And I think one of the big themes around trust is around what, and it came out with the Data Pact piece of work as well, and it's coming out in here. We're going to use private companies to help us build databases, all of these things, platforms. How can you reassure people here about, what is accessed by private healthcare, private companies? Who is, I think it's the term is data controller, is who's, it is our data. It is my data, and I want to know it's safe.
Yes. Yeah, absolutely, Rachel. And I think there's a few facets that was coming up through Sandra and Amin, so I'll try and cover it in the entirety. So Sandra mentioned about there's often 10-year vision statements, 10-year plans, and I think to your point, Rachel, absolutely, it's about that transparency that starts to build that trust and an understanding of publishing and reiterating and having forums like this that allows us to speak directly to citizens and patients, to build that trust around how absolutely we protect data. I can see lots of comments around the NHS is not above the law. It absolutely is not. And I think every individual that works in the NHS is fundamentally committed to protecting patient data. And you mentioned, why do we have to use technology providers? The NHS isn't a technology company, nor should it be. We're focused on delivering patient care, the same as we don't build X-ray machines and we don't build hospital beds. We have to work with partners who are the expertise in that area, and it's right for us to do that. It's not right for public money for us to go and try and build all our own technical systems. We should harness the benefits that partners can give to us. However, what is really, really important is those partners never, ever have access to that data. So you, as patients, it is your data. As you provide that data, you give the custodian to the NHS as the data controller, and that might be at your GP practice, or that might be at your clinician in your hospital. And we have very, very, very dedicated expertise in this area that makes sure that that data is then protected. It can only be accessed, to Amin's point, by the clinician that is delivering your care. And everybody signs up and ensures that they are only accessing your individual record to deliver your care. They are not selling it to companies. Companies do not have the rights to go in and access all your data. We have very, very stringent contractual, auditable constraints that are put on our technology providers. They are also externally audited. We have lots of stringent security controls. That means that accountability and separation is included in every technology provider. So no single technology provider can access that data. They are not data controllers. They are data processors, which is, without going too technical, they are commissioned through individual data processing agreements that say they are allowed to do this certain activity, which is a technical processing activity. They are not permitted to access that data, and there are sanctions and technical controls in place to stop them doing that. So the NHS at all time is the custodians of your data and ensure that that is protected. I think there is absolutely an element about transparency and making sure that we communicate in a way that is consumable and understandable, and that we spend the time with patients to really understand why we have to use different systems. Some of that is because we're a 75-year organisation. You know, we didn't start today, and if we did, we'd probably have one system that serviced lots of areas, and we'd have a single system that everybody could log into and access that patient information. But that's not how the NHS is a number of different organisations that's evolved over time, procured different systems over time. Of course, we want to consolidate, we want to simplify the landscape, we want to reduce costs, but actually that takes time and investment. And therefore, where we talk about delivering services that enables that join-up care, sometimes that is software that enables us to connect information. That's because we're having to evolve to move to a little bit more of a single system. But that does not mean that there's a big data grab and everybody can log in and access everybody's individual record. You know, we all are professionals in the organisation. We are all trained in data protection law and how data should be used. But I do think to that transparency and trust, you can only do that by you build trust by being transparent, being really clear about who is accessing the data, what they're accessing that data for, and reassurances around kind of contractual legal obligations, and actually ensuring we select partners that have to go through lots and lots of stringent checks to be a partner with the NHS. They have to comply to lots and lots of legislation and evidence, and are externally audited to ensure that they are compliant. I will pause there.
Brilliant. Thank you, Rebecca. Do you want to come back in on this point, Sandra? Because more than willing to. Your hand is up, I think.
Oh, yeah. So I think I just want to reiterate that the concern isn't necessarily within the NHS for me. I'm not concerned that my data within the NHS is at risk of being abused, misused. Things are going to happen. Referrals are not going to go through. Things are going to get missed. That's normal. We're human beings. That's not it for me at all. It's very much when third parties become involved. And I hear everything you're saying, Rebecca, and I'm immediately thinking about Grenfell and what we're learning about all the legislation in place, all the things that were seen and nothing done about. We have lots of legislation in place that to enact it requires, Mohammed and a mountain. I mean, it's not enough to say we are protected, there is laws, there is, all this stuff in place. We know it doesn't always work. So I hear you. I'm not trying to be difficult, but that's to say our experiences tell us that something other than what's supposed to happen often happens. Often, maybe not often, happens. I mean, maybe we draw often. But yes, the concern is that despite best intentions, despite steps being taken, and again, I come back to show me 6 months, show me a year, show me 2 years down the line. I come back to that. Without that, it's just words. Seriously, I gotta stop.
No, and Sandra, you're right, and I think thank you all, because I think this is a brilliant conversation. It is about 6 months down the year. It is about a year down the year, and reflect it like. The Grenfell thing just, it gives me shivers down my back, what happened, and listening to it this morning again in that radio, and about that transparency. But Rebecca, you are talking about transparency, and we all have GDPR, but I think one of the things that came out in some of the work that we were doing with patients was, when it goes wrong, Rebecca, and there's chances that it will go wrong, that there is going to be. I had a friend last night in another country whose bank account was hacked, and she got the fob posted to her, a new fob by the bank, looked exactly the same. It wasn't the bank's fob. So there needs to be honesty and transparency with patients about if data is breached, and when it is, what you will do and how you will talk to patients about that. I think that's kind of part of what you're saying as well, Sandra, is keeping that conversation going. And is there anything on that, Rebecca, that you can talk to?
Yeah, and you're right. I think Sandra has mentioned it a few times. It is the coming back and making sure that it's that continual engagement, continued sharing and of information. And when things do go wrong, I think being providing mechanisms that mean that we can understand what went wrong and we can learn from it, but also that patients can understand what that data breach is. We have a responsibility to describe that, and obviously we work with legislative organisations. That means that we do have to share some of that information when breaches do occur, and of course we comply to that and we work. But I do think it is around having the right mechanisms in place. That means that we can communicate in that way. I would say it is sometimes really, really difficult to ensure that we can give the right level of information consistently and transparently, and that's why really we engage with such as yourselves, Rachel, and making sure that we do run these panels and we do ensure that we're learning and listening, and then being able to tackle when things don't hopefully
Yeah,
is not
no.
done, Sandra, but when things go wrong, that we're able to deal with them and reduce and limit the risk of that happening. And some of that is through actually the advancements of technology. It does mean that we can protect our data in an improved situation. We do enable that if there is a breach, it's really limited, and that only comes actually from some advancements in technology. Some of the data breaches that happen across the globe, it tends to be when it's on really old technology that doesn't have the right protections in place, doesn't have the right software updates, and it's technology that's old. So actually using new technology in a way that enables us to protect against new world threats is absolutely fundamental for us to be able to make sure that we are limiting the risk, we're limiting the exposure in the event of a breach, and then being transparent and open to our citizens and our patients if their information is breached, and how they can seek support and help.
Brilliant. Thank you, Rebecca. I want to read, I have a question in the chat, and it's somebody working for population management. And what they wanted is to reflect that their engagement with patient representations is sharing the concerns highlighted by in the chat box and by Sandra and Amin. And they would like to understand, and maybe people could put the answer in chat, is how do people feel about your data being part of a wider understanding of disease prevalence, predicting future needs and planning what is the level of understanding of the different uses? So it might be just something to give some information from patients to that person for population health. I'll let you come in 1 second, Sandra. But then there's another thing, just kind of reflects to that chat. Sorry, I'm opening so many screens here. But there's another quote in the chat from somebody saying, concerned by the views that medical data should not be shared for research. My life was saved whilst in intensive care by a baffled clinician doing a Google search of my very unusual mix of symptoms and finding research that had been done into the very rare condition it turned that the research that had been done into the very rare condition that it turned out that this person had, and that saved their life. So I want to bring in, some bits into it. So if people want to reflect for that population health, Sandra, do you want to come in there?
Yeah, just to be clear, I have no issue whatsoever with my data being anonymized and being used for research, being used to look at, my age bracket, the issues I have, the symptoms they manage, the treatments that I've worked. None of that is of concern to me whatsoever. I am very happy for that to be used. My personal data being used for anything other than that. And when I talk about organizations external to the NHS, I'm not talking about research organizations. It's private sector really is my concern. No. Private sector is the concern for me. So absolutely, my data being used to help other people to show how things are changing, how things are moving, not a problem whatsoever. I just really wanted to be clear about that. Yeah.
No, and you were, Sandra, absolutely. And I think you're reflecting. You're reflecting a job that the NHS have to continue doing. And Rebecca, you're right. You do talk to us, and I sit in the Check and Challenge group, and there's lots of different people, and there is, but it's that ongoing conversation that isn't just we follow GDPR. We all follow GDPR. It's actually, what do we do? How do we continually maintain it? And you're a massive employer. How do you make sure that everyone is respecting that this is patient information? But I want to move on to the research, because we really do only have a few minutes left. And Sandra, you did bring this up, and it was another question that came up when we were doing some work around data, was that de-identification of data for research purposes. I don't know, Rebecca, if you can say any more on that, because it was, how do you make sure that anonymized data, that not able to identify individuals in that anonymized data. Sandra, I think that's also what you're saying in terms of using your data for research. You know, if you've got a real rare condition, is there a chance that if I've got, like, if I'm one of 5 people with a real rare condition and my data is sent for research, how easy is it for somebody to work out that it's me you're talking about?
Yeah, that's right. And we use lots of different methodologies to actually take away personal identifiers. And to your point, Rachel, there's something there about small number suppression and having certain rules around if we get into those really low numbers, then we absolutely there needs to be additional controls to make sure that you can't be identified as an individual, because if I know there's 3 of you and you live on the street in London, then you're more likely to be identified than just knowing there's 3 of you in the entire population and not having other information that can be put together to enable you to re-identify an individual. So those are some of the kind of policies and applications that we have to apply when we're thinking about how do you remove how do we remove information
Rebecca, we seem to be getting dreadful crackle, a really bad crackle on this call. So it was me who turned off your camera for a second to see would it go. But it seems to be gone now. So I'm going to go back on mute. So Rebecca, I'm sorry, I think we missed the last couple of sentences.
Okay, is that okay? Are we good?
It's a little bit better, but I'm going to let Amin come in and give it a chance to settle down. But, you know, if it is what we have to live with, thankfully it's not there for hasn't been there for the whole hour. Amin.
Thank you, Rachel. Very briefly on sharing data, I think when you hear our data is being shared, there is anxiety amongst patients. I think we need to communicate clearly and effectively with the patient or carer that how data is shared and who are we sharing it with. And having that discussion can, I think, resolve a lot of anxiety from patient. I can give you one personal experience. The place where I work, often there is a question in the registration form where the registration form asks patient, are you happy to share your information? So you get straight no answer from patient. But what I have done recently, that I have expanded on it. What do you mean by sharing this data and who are we sharing with? That has made a significant change in terms of patient deciding who are we sharing this information. So one thing I added when I'm sharing this information with the third party or private sector, when you tick some of these boxes, that means you're sharing with the healthcare professionals or the NHS accredited researcher. They will be using your data, also ensuring that your personal information will be kept confidential. Thanks.
Okay. Thank you. I'm sorry, but I think we need another session on this because I have so many more questions I want to ask, and I'm trying to theme all the questions I'm seeing. And one of the things I wanted to ask you about, Rebecca, is, or maybe there's something we can come back and talk about, those future data trusts, those model of governance for data sharing, how they manage data. But I think we are going to have to come back to that. There's another session coming on data, but you know what, Rebecca, this is what we've all been saying. We need to continually have these conversations, Sandra. So I'm hoping you'll be willing to come back and have a further conversation as we do this. So I'm going to come to each, I'm mainly going to come to you, Amin and Sandra, and like, what is your 1 minute takeaway for the NHS as they develop data and how data can and data to make sure that patients get some really good joined up care? So Sandra, I'm going to come to you. Oh, sorry, Amin, you got your hand up first.
I'll let Sandra go first. Thanks.
Amin looks ready. Off you go, mate. You're good.
We haven't got time for you to fight over who's going to go first.
Right. I think we need more patient input, and we need to discuss this with patient, because I can only speak for myself. I think patient's voice is paramount, embedding in this decision making, also taking their concerns on board, then make a streamlined process how we do this. Thanks.
Communication, ongoing communication. I don't think the NHS has had a good track record around speaking to patients on an ongoing basis, on a wide scale. Not even just patients, just people. Hey, this is what we're doing. This is how it's going to affect you. You don't have to be a patient to know what's happening in the NHS. We should all be invested in it. And so just being able to explain to people what's happening, and genuinely being able to come back and say, we hear your concerns. Here's what we're going to put in place. And the comeback checks, and we're having a further conversation, and it's working, it's not working, we did this, we changed that. Something that reassures me that actually I'm being heard, and this is seriously, being taken seriously. Yeah.
Rebecca, what's your final reflection?
Yeah, thank you, Rachel. And I think we're absolutely right. We need more of these. We want to ensure that we are listening and reassuring. And where there are comments in the chat to say there are things that go wrong, and that's what we are trying to ensure that we tackle, and whether that's through enhancements in process and how we do things, whether that's advancements in technology. I think they've all got to come together to ensure that we are able to deliver the best possible care we can, provide our clinicians with the information that they need, but also ensure that we're protecting and giving our patients the choice in how they use their data, understand how their data is stored, and that might be through other mechanisms, but also, to Amin's point, clearly communicating so that patients are reassured on where it is legal or right to do and share data for research or to improve services and care. I think being really clear about how we do that and how we do that safely, and everybody's reiterated on here that isn't about patient identifiable information. It's about thematic or synthetic versions that actually give trends but don't identify an individual. And I think we're all passionate about that. We might not necessarily communicate it very well and are not transparent enough about it. But I think that's why these conversations are so important, and why we need to continue to make sure that we are working in the open, working transparently, giving information that is consumable. Thank you, Rachel.
Okay, I'm sorry we have run out of time here, because we do have a lot more questions that need to be addressed. Rebecca, we may work with your team to try and address some of the questions that we just could not get to here today. But also, I think that we need a part 2. If you're all happy with thinking about a part 2 in a few weeks' time, to come back in and address what we haven't been able to address in that hour. But it's fabulous, and I think what the other bits that I've been seeing in the chat and in the Q&A that we haven't been able to get to properly is, and again we can get some information for you on that. But I do think it's something about being heard and listened to, but also evidence. People want evidence to know that it's safe. So it's not just being told their data is safe. They want evidence to how it's safe, and I think that's really important. And I think people are asking, could we do another webinar, and maybe they could put some questions to us, because the other bit that I think we need to cover in another webinar, Rebecca, is, and Sandra, and Amin, if you're willing to come back to us, is there is an issue around accuracy of some medical records and how people can correct them. We can give some information on that. There is evidence, there is some stuff around consent and opt-out, and I know there's some information on NHS England's webpage, so maybe we can pull that and send it out to participants. And we didn't even get to the primary and secondary care integration. I'm sorry, we ran out of time because there's so much to talk about, but we will see you soon. to talk about this again. Thank you so much for attending.